My name's Sam Janes. I'm the chief investigator on the SUMMIT study, and I'm a chest physician at University College London. Lung cancer tends to present late. So 4 out of 5 of the patients I see in my clinic have often come for the first time to see me with cancer that is incurable because it is spread around the body. CT screening for lung cancer is crucial so that we can detect it much earlier and give more successful treatments. In fact, for all cancers, early diagnosis is important.
The SUMMIT study is a large-scale study for people with significant smoking histories between the ages of 55 and 77. It began in North and East London and now extends to South East London.
The study has been set up by a university, University College London, and a hospital, University College London Hospitals NHS Foundation Trust, in partnership with GRAIL, a US healthcare company working to develop blood tests to detect cancer early.
So we have 2 aims. The first aim of the study is we look at the feasibility of delivering CT screening for lung cancer to a large population. And the second is that we develop a blood test that will detect not only lung cancer, but several different types of cancer early.
My name's Dr. Tanya Anastasiadis, and I'm a jobbing GP in Tower Hamlets. I see this as an opportunity to influence and also to get involved from the outset with something that potentially our patients will benefit greatly from.
Working in an area like South East London where we have high rates of lung cancer, high rates of premature death due to lung cancer, as well as very high rates of chronic lung disease due to smoking. It's really exciting now to be able to be involved in this study to try and help diagnose lung cancer at a much earlier stage so that we can offer people, hopefully, curative treatment.
The SUMMIT study will invite people with significant smoking histories via GP registries to take part in the study, and they'll be offered a free lung health check. This will include a respiratory health assessment.
There are 4 sites that people can attend for their lung health check. So there's Mile End Hospital, there's King George Hospital, Finchley Memorial Hospital, and then University College Hospital.
We appreciate that people attending from South East London will have further to travel. So to try and ensure that people don't have to travel on public transport at peak times, there are some priority slots between 11 and 3 p.m. For people specifically attending from South East London.
The lung health check will be offered whether or not a person is interested in participating in the study. They'll be asked to read the patient information sheet, fill in a questionnaire, and if they consent to the study, then on the same day, they will also be offered a low-dose CT scan and give a blood sample.
So in terms of management of the results of the low-dose CT scans, those who are found to have pulmonary nodules are going to be followed up by the study itself. And then those who are found to have anything deemed possibly sinister will get referred by the study group into the local pathways. And so that responsibility won't be coming back to the GPs, which I think is fundamental to safety netting around patients.
The blood sample results don't get fed back to either the participant or the GP. What we're going to look for is what we call circulating cell-free nucleic acids. And what GRAIL is developing is a test that can detect cancers from these nucleic acids that are floating around in our circulation. Participants will be asked to return for 2 further annual visits. We've worked hard to make sure the study is safe, convenient for participants, and minimally disruptive for primary care. This study is not only a chance to improve the health of the local population, but also take part in groundbreaking research that could, in the future, enable us to detect cancer earlier and have effects across the world.